More now on health funding. As we heard earlier, officials are warning of a major funding gap ahead in England's NHS budget. The BBC understands that there is a projected deficit of up to £2 billion in the financial year beginning next April. The independent think tank Reform today released a report saying changes were needed to NHS hospitals and GP practices to better integrate provision and allow for greater use of private providers. With me now is Cathy Corrie from Reform, and Dr. David Wrigley, who's an NHS GP and BMA UK Council member. What does Reform see as the solution to this funding gap?
Well, the report is addressing two fundamental challenges that the NHS faces, and the first is a demand challenge. It's about how does the NHS react to an ageing population in the face of falling budgets to fund those services, but it's also about a quality challenge. It's about how does the NHS meet the needs of a population where patients' needs have changed fundamentally in the last 20, 30 years.
And your answer is more privatisation?
And the answer is that services have to radically change, really radically transform the way that we deliver them. And part of that answer is going to be about how we harness the role of competition and greater use of new entrants in the market, whether they're from the private sector or from the voluntary sector, to drive innovation in the way that care is delivered to patients.
David, what do you think of that?
Well, this report is all about bringing in more private providers into the NHS, and as a GP I like to use evidence, and there's no evidence whatsoever that bringing competition and private providers into the NHS improves care, and indeed it's very costly. We just need to look at America, where it's the huge privatised healthcare system. They spend twice as much as we do on healthcare per person, and yet today the independent Commonwealth Fund has announced that the NHS is #1 in the world for providing care to the NHS. And indeed, Reform, and they're very open about this on their website, they are funded by many private sector companies to the tune of £1 million. Companies who will benefit from these reforms that we hear about in the NHS.
The Washington-based Commonwealth Fund did indeed say that today. So in that sense, they also basically said we are the best value for money in the world.
I think what we have to remember is that this isn't a question about the here and now. This is about how do we make sure the NHS is high quality and affordable and sustainable for the long term. And these challenges which it faces about an ageing population and rising demand and the rising cost of providing high quality treatments, they're always going to increase.
Haven't we always had that since the 1940s, though? We've had an ageing population because people have been healthier and more demand, and we demand better care. We've always had that.
Absolutely, it's been a growing challenge facing the NHS, but right now NHS England has predicted, for example, that by the end of the decade the NHS will be facing a funding gap of £30 billion.
There is a funding gap, isn't there?
Well, this is a fallacy. I mean, all those who wish to bring in private companies into the English NHS talk about a funding gap, but the NHS, if you look at the accounts which are published annually, has a £2 billion surplus each year. Now, the Department of Health promised that that money goes back to patient care, but in actual fact it's gone right back to the Treasury at the admission of the Department of Health.
But there are a lot of areas who say, you know, we have balanced our books up to now, but it's going to get very, very difficult in the next couple of years.
Well, if that £2 billion was put back into patient care, then that would go a long way. Foundation trusts are showing deficits of about 800 million. Well, that's half of that surplus. So politicians need to answer to this. Those who wish to bring in private companies are doing down the NHS, which, as we've just heard, is performing fantastically. It's one of the best in the world.
Don't you worry that your report effectively says the way to reform the NHS is not to have the National Health Service that we've had for 50 plus years?
The way to keep the NHS providing high quality care for the patients that it serves is to really radically rethink it, and I think a lot of patients would get behind that. If you look, say, at primary care, there's growing frustration with mounting waiting lists, with real troubles in terms of accessing care outside of working hours, with a lack of online services which you'd expect to see. So rethinking care is something which is clearly going to be needed in the years ahead, and competition and new entrants into the market we've seen in other countries and in other industries is a key way of achieving this.
Well, primary care has been starved of funds, and it's there, it's out in the public domain that funding for primary care has reduced from 10% of the NHS budget right down to below 8%. This is what's happening, that we're being starved of funds, and that's why it's so hard to get an appointment. And Germany, actually, they went down the model of wanting to charge patients for appointments, as Reform have advocated, and they've actually just voted to stop that because of the huge amounts of bureaucracy. Patients actually stopped going to the doctor, and that's a really worrying concept.
Why? Because it costs more
because
in the
of the
long
money,
run.
yeah. So you'll go back to a pre-1948 era where people don't go because they're afraid of...
But don't you worry that the National Health Service has been so much at the heart of the political consensus in this country, we haven't really had a hard look and rethought whether the basic principles are still worth preserving? The
basic principles are, I mean, I go around the country speaking to people and they absolutely support the NHS as a publicly provided, publicly funded body, and the funding is there. We need to tackle this. The politicians need to own up and talk about the NHS and the funding. The gap that's there is not a reality gap. You know, the money is there because of that surplus, and we need to talk honestly about that and not talk about bringing in private companies which will make the NHS worse and take us down an insurance-based healthcare system.
Final thought?
I think the NHS, if we want to preserve it as the high quality service that it is, we need to look to strive to be better and to strive to give better value for money for the taxpayer in an era where all budgets, not just the NHS, are under immense strain and immense pressure. And that means radically rethinking care, and part of that is the role of competition.
Cathy, David, thank you both very much. Thank you. Now, the headlines at just after 9:15.